हेलो सर, गुड आफ्टरनून। मैम स्टार्ट करें।
Sure.
गुड आफ्टरनून एवरीवन। आई एम डॉक्टर नुपुर, जॉइंट सेक्रेटरी ऑफ DHMA. I welcome you all in DHMA monthly CME. So I would like to introduce DHMA. DHMA was established in 1932 by Dr. Yudhvir Singh. He was the former president. I'm sorry due to some network issue. So welcome you all. So DHMA was established in 1932 by Dr. Yudhvir Singh. He was the first health minister of Delhi, highlighting he 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 was
I think there are some network issues at Dr. Nubu's side. So I would like to introduce DHMA with all of you. So first of all, I welcome you all at the monthly CME in line with what DHMA has been conducted on the last Sundays every month since it was established and registered in 1932 by Dr. Yudhvir Singh, making it the oldest and mother association of all homeopathic associations in Delhi. Dr. Yudhvir Singh was the first health minister of Delhi and the first chairman of the board of Homeopathic System of Medicine in Delhi, where he held the position from 1958 to 1969. He founded this library, Nehru Homeopathic Medical College, and various charitable homeopathic dispensaries in Delhi. Along with these CMEs, ladies and gentlemen, we keep conducting various educational activities like webinars, national conferences, quiz, health camps, etc. This time we have gone online for the CME, and I can see many of you have joined across the country. Uh, So those who still are not the members and wish to join this esteemed organization may visit our website www.dhma.in or write to us at dhmadelhi@gmail.com, or you can also contact us at 9711 So being the president of the association, this esteemed organization, I welcome you all to this CME, and I heartily welcome our speaker of the day, Dr. Rajneesh Kumar Sharma sir, who is the executive member of Delhi Homoeopathic Medical Association. Uh, about Sir, he is the privileged executive member, as I already mentioned. He is a life member of Homeopathic Medical Association of India, life member of Indian Institute of Homeopathic Physicians, life member of Indian Medical Legal and Ethics Association, medical examiner in Life Corporation of India, faculty to several national and international conferences, recipient of many international and national awards. He is the executive editor of Hanimanian Homeopathic Sandesh, a peer-reviewed journal by DHMA itself, and author of numerous research papers, articles, case presentations, and books. He's the chief managing director of HomeoCure and Research Institute, Web of Homeopathic Pharma, and Spurs Multi-Specialty Hospital. So welcome you, sir, once again at this platform, and we are very much privileged to have you today with us. एंड आई नो जो आपका टॉपिक है इट इज़ वेरी मच इंटरेस्टिंग. हमें सबको पता है कि हम अपनी गलतियों से सबसे ज़्यादा सीखते हैं, एंड योर टॉपिक इज़ लाइक योर फेलियर्स इन होम्योपैथी एंड लर्निंग फ्रॉम योर फेलियर्स इन होम्योपैथी. सो वी आर वेरी मच लुकिंग फॉरवर्ड टू दिस सेशन. वेलकम सर.
थैंक यू वेरी मच. सबको सादर नमस्कार और जन्माष्टमी की बहुत बहुत शुभकामनाएं. बहुत अच्छे दिन आज हमारी मीटिंग हो रही है. सबको त्योहार की भी बहुत अच्छी तैयारियां चल रही हैं.
थैंक यू सर. I would like to request all of you to please mute yourself and turn your video off so that you can have the best presentation. Thank you.
देखिए हिंदी इंग्लिश मिक्स शुरू करते हैं ताकि फॉर्मेलिटीज ना रहे, क्योंकि सब घर के लोग बैठे हुए हैं. First of all, we must learn from our failures. In my opinion, failures are the best teachers. They are the best mentors, because in each and every failure we learn something and we have a motivation to improve ourselves. A few persons are there who can get frustrated due to failures, but in my opinion, we must learn and learn. This is a lifelong process. I will tell you some steps from learning from the failures. First of all, learning from failures is crucial for personal and professional growth. For your professional as well as personal growth, we have to learn. We have a lot of failures and very few successes in our life. Failures are in plenty amount. So then we have to learn from our failures more than our successes. First of all, we must reflect on the failures. Take time to analyze what went wrong, why we failed. Ask yourself specific questions about the failure, such as what factors contributed to the fail and what could have been done differently to avoid the failures. The second one must be acknowledge your emotions. It is normal to feel frustrated or disappointed after a failure, but allow yourself to experience these emotions, but do not let them cloud your judgment. Use them as motivator to improve. The failures can be used as motivators or mentors. Another point I want to tell is seek your feedback. Sometimes an external perspective can provide valuable insights. Talk to your mentors, talk to your colleagues, talk to your friends about your failures. Do not feel shy, and they will improve your situations. Another point may be identify your lessons you learned. Pinpoint the key lessons from the failure. What did you learn about yourself, your approach, your situation? Write these lessons down to your notepad, and which can be referred later to your colleagues. Adjust your approach. use the insights gained to modify your strategy or approach. This might improve your changing your methods, setting different goals, acquiring new skills in your life. Set realistic goals. Goals must be realistic, not the phantom goals. All the goals must be realistic, which can be fulfilled, which can be achieved. After learning from a failure, set achievable goal that will help you apply your knowledge, and you will not fail in any mode. Break these goals into smaller and manageable steps, done step by step, so that the failures can be minimized. Maintain a positive attitude. Keep a positive mindset to view failure as stepping stones. Each failure is a stepping stone. It use your failures as like a stair or ladder to rise up to your missions or goals. Maintain a positive attitude always. Practice self-compassion. Be kind to yourself and recognize that failure is a part of learning process. Avoid self-criticism. Never criticize yourself and focus on growth and improvement further. Take action. Never be silent. Take action. Implement the changes and strategies you have identified in your failures. Action is crucial for turning learning into tangible progress, and which will lead to your success in future endeavors. Review and iterate. Continue to assess your progress and make adjustments as needed. Learning is an ongoing process, but being open to continual improvement, it will help you to succeed in life in future in long run. Let us come to the point. 1 minute. सर अंदर चैम्बर में आ जाइए, खुला हुआ है. हाँ चैम्बर में नीचे क्लिनिक में अंदर आ जाइए. सॉरी. There are some facts which will reflect the dark side of homeopathy. You know, homeopathy is the second largest system of treatment in the world. This is the definition by WHO, and WHO has clearly defined the homeopathy is the second largest system of treatment. Homeopathy is supposed to be non-scientific by advocates of so-called modern medicine. 99% of the practitioners of other pathies, maybe Ayush physicians may be supportive, but other than Ayush physicians, each and every 99% they believe the homeopathy is not scientific. Continuous efforts are being done by non-homeopathic doctors to defame and quench the authenticity of homeopathy, because there are a number of quacks which are using homeopathy and they are spreading the myths that homeopathy is very slow, it has no side effect, it will be not harmful if it is not effective, and so on. And various publications are there in world which are ready to bout the span of homeopathy. I will show you a few of them. This is one of the examples, the print, which is published in Scientific American. This is the article which says homeopathy may be very popular in India, but global experts dismiss the efficacy. Forget coronavirus, homeopathy cannot cure anything. It is the placebo at the best. Now they are saying homeopathy is nothing but a placebo. Another British Journal of Clinical Pharmacology says the truth about homeopathy. There is a statement about the clinical trial which showed that homeopathy was nothing than placebo in the morphine consumption after surgery. Another example, better example from this board. This is again from Scientific American. Hundreds of babies are harmed by homeopathic remedies, families say. And we believe the homeopathy is the safest one for babies, but they are publishing. Now, who is responsible for decay of homeopathy? Who is responsible? We are, obviously, we are responsible. I have categorized the doctors, homeopathy doctors in 5 categories. A first category is the doctors, the homeopaths who are internationally famous. The second, the homeopaths who are nationally famous. Third, the homeopath group of homeopaths which is famous in a zone or a state. Another group, the homeopaths who are famous in a region, particular region, a particular districts or particular area. And the last group, the local group, the homeopaths which are struggling for better practice. They are effective in a particular area, street or mohalla or that particular tehsil. The doctors who are internationally famous, they have the group of renowned homeopaths. They have clinically very high impact. If a doctor homeopath who is internationally famous and he commits a mistake, that will impact very badly internationally to the homeopathic fraternity. The homeopath who is nationally famous, his mistake will have very high impact at national level, and the homeopath who is zonally famous, his impact will be high, and that will be localized to the zone. And the homeopath who is famous in a town, he will also have appreciable impact in the decay of homeopathy. If he commits a mistake, this will affect the region. And the newcomers or struggling homeopaths, they will also, if they are committing some mistakes, it will have no impact, but at local level, this will be also bad. Then we can categorize these homeopaths in certain groups. Now, who is responsible? This has been discussed. Now, responsibilities of homeopaths for promoting and cherishing homeopathy, this can also be categorized. The internationally famous homeopath, who are famous internationally and they are internationally recognized, these homeopaths have more responsibilities. They are I have given them grade 1. The internationally famous homeopath must be very cautious, and they must publish their miracles, their cures into certain various magazines, newspapers, and interviews. They must propagate homeopathy at global level. The nationally famous homeopaths, they are categorized into grade 2. They must discuss their success stories at national level, and so on. The zonally famous homeopath, grade 3, regionally famous homeopaths, grade 4, and locally famous homeopaths, grade 5. They must propagate homeopathy at their particular levels with heart and soul. We must learn from our failures. I have discussed in the beginning of the slide the 10 points regarding this learning from failures. There are some suggestions. In intra-homeopathic seminars, where only homeopaths are being gathered, we must discuss about failures. In absolutely homeopathic seminars, the failures must be discussed. We must discuss about causes behind their failures. We must discuss about our limitations, what the limitations the homeopath has. We must discuss about the solutions to reduce the frequency of failures. We must discuss in our homeopathy seminars what are the causes behind these failures and how can we avoid these failures. We must discuss to reduce the limitations and expand the domain of homeopathy. This is very difficult point, and we have to work very hard on this point. We must have to maintain the domain of homeopathy, legal domain of the homeopathy, but we must have to reduce the limitations of homeopathy. We must make the area of homeopathy very broad. In intra-homeopathic seminars, where homeopaths are also there and allopaths are also there, or mixed community is there in CMEs or seminars, we must discuss about we must not discuss about our we must publish our achievements. I have already told. We must acquaint us with full of knowledge and confidence in intermedical streams or intermedical seminars, where the doctors of different streams are there. We must publish, we must discuss only our achievements, never discuss about our failures or weak points. We must publish our scientific papers with full evidences. We must advocate the efficacy of homeopathy with facts and proofs. We must collect the proofs or in the hard copies or video or the statements of the patients. We must educate others about positivity of homeopathy. We must try to show the bright side of homeopathy to others and keep the dark side of homeopathy for the homeopathy group only. For other pathies or other scientific group, we must discuss about our achievements. We have done this with evidences. And in homeopathy group, we can discuss about our failures and to discuss on the points so that the failures can be avoided. we must not have a delusion of having superhuman or parascientific powers. For homeopaths, it is assumed that homeopaths are superhumans. They are having superpowers. The patient comes, the carcinoma is there in advanced stage. Each and every pathy has been tried, and all the doctors, all the hospitals have reviewed. Now they expect a homeopath will give a single dose of remedy, and the patient will be cured. This is expected from almost each and every homeopath. The public thinks the homeopaths are superhuman, but you have not to be indulged in this never have delusion of being superhuman or parascientific person. We must know the limitations of cure in a case. What is curable in the disease? We must know the limitations of homeopathy. What can a homeopath do and what can a homeopath cannot do? We must know the advantages of homeopathy. We all know. We must know the limitations of other systems of medicine also. What allopathy cannot do, what surgery cannot do, what other Ayush systems cannot do, and what can we do. This must be clear to each and every homeopath. We must know advantages of other system of medicines also. Why surgery is good in some particular diseases, particular cases, why it is mandatory, why allopathy medicine is mandatory, why it is important, and why it is unavoidable in certain type of emergencies or cases or management. We must know the scientific explanation of the diseases, treatment, and cure. In homeopathy, this is very common problem. A particular homeopath treats pulmonary tuberculosis within a week. He claims, I will give you a single dose and you will be all right. Our ancestor doctor was cured of pulmonary tuberculosis with a dose of pulsatilla 200 in a single dose. But we do not know the exact time. He might be cured within 6 months or after 6 months. But a particular group of homeopath can claim we can treat tuberculosis within a week, within a month. But truth is far away. Tuberculosis patient cannot be cured in less than 6 months. It needs a time of 6 months to get cured. Never claim in certain type of diseases where cure cannot be completed within a particular set of time. It will take time and it will be provided to the patient. I've always discussed that your tuberculosis will be treated and it will take minimum time of 6 months. It might be exceeded, but minimum time of 6 months should be there. This is scientific. But within a week cure of tuberculosis, this is not scientific. Often, miracles are not scientific. What is miracle? Anything which cannot be explained by science, this is miracle. We must not exaggerate the cures into miracles. Miracles are supposed not to be related to science. Miracles are related to be parascientific, superhuman, or godly act. ईश्वर ने ठीक कर दिया. Cure whenever unexpected. Cure whenever unexpected. When we believe that this case is very difficult to cure, or cure is very quick than expected time, it may be called as miracle. Any cure which is unexpectedly early, quick, or unexpected may be categorized into a miracle. Miraculous cure, this term can be used. This is a cure, but this is a miraculous cure, which is it was not expected in such a manner. It is very early cure and a very quick cure, very easy cure. Then the term miraculous cure may be used in a place of miracle. So miraculous cure may be easily be explained in the scientific terminology. Now I will discuss a few cases of failures which were faced by me in my day-to-day practice, and I learned a lot from that, and I will be discussing lessons from my failures. In my 32 years of practice, I have seen several cases, and a lot of failures were there. Some miraculous cure were there. Some expected cures were also there, but I will be discussing the failures. I have never disclosed my failures in different seminars previously, but for last 2 years, I am discussing about the failures because these failures are very important to learn. Let me come to the point. This is the failure number 1. There was a case of hepatic cyst. Very proudly, I took the case. Case history was taken very carefully. The symptoms collected, I will recite. Fat desire, sour food, acids aversion, impatience, irritability, bubbling sensation in abdomen as if bubbles were moving about, abdomen pain, burning, stomach pain. The aggravation was in general in daytime, in morning, and nights were better. He was ameliorated in nights. Complaints were in the region of liver region. Prostate gland was enlarged. The rubrics were categorized, evaluated, and repertorized. The sulfur was the king remedy. It was covering almost all the symptoms in the patient. And the patient was also, he was stoop-shouldered. He was looking like a sulfur patient, indeed. And I prescribed sulfur. Now, let us see what happened. I prescribed sulfur in 200 potency to that patient. And next day, the patient was brought by the attendants. The hepatic cyst was ruptured. Sulfur did its work. Cyst was ruptured. Patient was in serious condition. Septicemia started, and the patient was shifted to ICU. After investigating ultrasound and blood reports, it was confirmed the rupture of the hepatic cyst. I was shocked, and I tried to understand what was wrong with that. The compromising factor were the patient was in old age. He was immunocompromised. He was having history of COVID actually. The SORA was in latent condition, and sulfur, a dose of sulfur reactivated that latent SORA into active SORA, and acute inflammation started. The cystic lysis took place, and hepatic cyst was ruptured, and the patient was shifted to ICU. In ICU, I started again repertorizing the case. The second remedy was aconite, because there was acute inflammatory stage, and that was having a sudden onset, acute onset, aconite, which was the acute of sulfur. I prescribed aconite in 200 potency in 3 doses at 10 minutes interval, and patient was improved within a couple of hours. And again, the sulfur was given on 3rd day, and the case completely cured. The ultrasound reveals there is no evidence of cyst except some scar in the liver. Now, what is the lesson from this one? In critical chronic cases where gross pathological changes are there, like hepatic cyst was there, which can be recognized, which can be seen with a tool, ultrasound, CT scan, or any pathological report. Whenever there is gross pathology, we must start with acute remedies. Never give chronic remedy in the beginning. Never give anti-miasmatic remedies. Never give nosodes. Just start with acute remedies. If suppose some chronic remedy is indicated, but suppose natramur is indicated in particular case, just start with ignitia or apis. Never give natramur in the beginning. This is the lesson from first failure. Now, the failure number 2. A case was there. A child was having atopic eczema, and that was treated allopathically, and child was improved. But for each change of weather, he develops the atopic eczema, and for permanent cure, the attendants of the patient, they consulted me. The symptoms taken were onion desire, eczema in childhood. The child was persisting in nothing. He was very petulant type, moody type of patient, and he was having aversion to play with the toys he has. I repertorized the remedy: rheum, lycopodium, calcarea, sulfur, staphy. A number of remedies are there in repertorization. You can see I selected lycopodium because it was covering a lot of symptoms of that patient. Lycopodium was given in 30 potency thrice daily, and the patient was aggravated badly. On 3rd day, he was brought to me with suppuration on all around the skin. There were papules, there were pustules, there were a lot of blister-like eruptions all over the body. I analyzed the case. He was put in the pediatric ICU for high-grade fever because that was due to secondary infections. The second analysis revealed the age was very low. He was a child. He was hypersensitive and autoimmune one. Sora was in active condition. Lycopodium was a similimum drug, and I repeated the drug into 3 times daily for 3 days, and the severe aggravation took place. Why? Severe inflammatory process was initiated in the patient and immunity was compromised. The opportunistic infection took place. A lot of streptococcus and staphylococcus bacteria invaded that particular patient's skin, and pyoderma started, and he developed a septicemia-like stage with high fever and a lot of symptoms. The second prescription, I analyzed the case again. There was acute inflammatory and suppurative stage, and mentals was there. He was having aversion to the toys and aversion to play, and he was very moody. He was a very petulant patient. The symptom was in rheum, and I prescribed rheum in 200 potency, and the pyoderma disappeared within a couple of days, 2 or 3 days after. He was much improved. Fever vanished after a few hours, and again the lycopodium was used as complementary remedy in 200 potency single dose after a week, and the case was permanently cured. What was the lesson from this failure? In hypersensitive and autoimmune cases, we must start the remedy similar to the mental symptoms. Whenever the patient is hypersensitive or he has been immunocompromised or had autoimmune disorders, just start with mental symptoms, and remedies should be prescribed on mental similar totality. Another case, there was a case with seizures. The patient was having convulsions. The case was taken very carefully. There was a mental symptom, injuring himself. He was a hysteric one. Hypochondriasis was there. The convulsions were in only deep sleep. Menses were absent because she was a hysteric woman. The rubric was menses absent in hysteric woman. And during sleep, she perspired on scalp only, and perspiration of scalp was aggravated just before a fit, just before a seizure. These were the symptoms I took. These contain the mental and physical symptom or physiological symptoms also. The simillimum remedy appeared to be Silesia. And of course, Silesia is very good remedy for hysteria. Silesia is very good remedy for convulsions. Silesia is very good remedy for such type of amenorrhea, and so on. I prescribed Silesia, and patient after a few hours, 2 or 3 hours after, the convulsion started badly, and the patient was unconscious. She collapsed and was shifted to ICU, or rather she was ventilated, and after endotracheal intubation, the ventilation was done, and patient was compromised with allopathy measures, which were adopted to save the life. And the treatment was homeopathic. So she was observed very carefully again. What are the observations? She developed intracranial hypertension. Due to intracranial hypertension, the compression of the brain developed, and she developed a lot of convulsions and went into the status epilepticus and was collapsed and maintained with ventilator. In this case, hypersensitive hormonal compromised patient was there whose menses were suppressed. Here, Sora was active. Silesia was the simillimum remedy and caused aggravation in each and every element, and cerebral hyperemia developed, the congestion to the brain developed, and intracranial hypertension badly developed, and she went to ICU. During observation, I found the symptom which were taken in repertorization, but I failed to consider that menses absent in a hysteric woman. There was a single remedy, that was Cypripedium pubescens. By luck, this rare remedy was in my chest, and I used in 30 potency because only 30 potency was available with me. And after giving a few drops with oxygen pipeline, she inhaled, and there was much improvement. And after second day, after 20 hours after, the ventilator was removed and the patient survived, and patient was in a better position and shifted to general ward. And Cypripedium was used 30 potency thrice daily for 3 days, and patient was discharged in very improved condition. And the patient is still in my treatment, and Cypripedium is continued because 200 potency or high potency are not available in market. Therefore, only 30 potency is regularly given to that patient. What is the lesson from this case? In hypersensitive and hormonal compromised cases, we must start the remedies based on causations. She was taking contraceptive pills for long times. She was being treated for increased prolactin with cabergoline for a long time. And she was very badly compromised hormonally, and she was hypersensitive mentally. Therefore, she developed such type of aggravation in the homeopathy practice, and I was failed totally. She was just collapsed. But by luck, I was having ventilator in my ICU, and that was vacant, and she survived. Then we must analyze each and every case very deeply and with complete pathology. We must read its pathology also. We must understand the prognosis of the case also, and only then we can prescribe the remedies. In such a case, causative remedy must be given. Another case that was having spondylolisthesis. Spondylolisthesis is the condition where a disc is shifted over another disc, either posteriorly or anteriorly. The case was having severe backache and sciatic pains. Sciatica pain was in right side. The case was taken in the manner. He was abusive towards family. He used to abuse his family members. He was very unsympathetic toward the friends. He was censorious. He used to criticize the dearest friends also. There were the lack of vital heat. He used to wear a lot of clothes and covering during sleeping. Right side sciatica was there, which was ameliorated by lying down on the back. That ameliorated the patient's sciatic pains. And he cannot move because motion aggravates the sciatic patient in this particular case, and pressure ameliorates the sciatic pains. And this patient was having aversion to sweets. He never preferred to eat sweets. In repertorization, you can see bell, brania, lachesis, phosphorus, pulse, ruta, arsenic, baryta. A number of remedies are there. Because the symptoms were not clear, I started with zigzag prescription in this case. I first of all, I prescribed Guacum as a minimum remedy, but after 5 days, no improvement was there. I tried Kali iode next time. For 5 days, Kali iode was given, but no change. Afterwards, I prescribed Bryonia alba for 5 days. Nothing happened. Then Polosynthis for 5 days, failed. Pulsatilla for 5 days, failed. Tellurium, failed. Lachesis, failed. I was very much disappointed with this case. The best selected remedies were failed again and again. Then I analyzed this case on pathological basis. There was a mechanical disorder. The vertebra was shifted anteriorly over another vertebra and was pushing the disc posteriorly, and that was touching the nucleus of the nerves, causing sciatic pains. This is the causa occasionalis. There was dislocation of vertebra. The patient was bedridden within a month's treatment, and he was admitted into a private ward, and traction was given to that particular patient in the ward. The second prescription, I thought of dislocation of vertebra over another, which was causing the pain and radiculopathy. Physiotherapy was started, traction was given, and spinal manipulation was done with the help of physiotherapist, and patient was slightly improved. The mental rubric was there, censorious, desire to criticize everything. Goecum was a single remedy. Why I selected this mental only? Because I have prescribed Goecum earlier also. That was in the journals. This time Goecum did miracle, and the patient was improved within a couple of days, and he was absolutely fit and fine. With the help of a lumbar sacral supportive belt, he was discharged, and after 1 month's treatment, he can now run, he can do his works, he can stoop, he can walk easily. Now, what is the learning from this type of case? In disorders with biomechanical changes, where some mechanical changes are there, we must start with physical or surgical measurements along with the indicated remedy. Whenever there are gross pathological changes or some mechanical disorders, we have to minimize the disorder either with physical manners or surgery, so that we can support the patient in a real way. Suppose a huge brain tumor is inside the brain scalp in the cranial cavity, and he is compressing the brain tissue, which is developing a lot of symptoms. What will be the responsibility of homeopath? He can reduce the size of the tumor so that the pressure can be minimized and the symptom can be alleviated. But if the growth is very hard and that is not possible to reduce the growth, we have to remove the growth either completely or partially to release the pressure, and only afterwards the homeopathy remedy or any other remedy can help that particular patient. Now we have to analyze our failures and learn from these particular failures. The first of all, diagnosis. Failure in disease diagnosis. Whenever we fail in diagnosis the correct disease, we cannot ascertain what is curable in the disease, and we cannot ascertain the prognosis, and we can fail again and again in particular case. For example, there was a case treating a plantar wart with mimicry of plantar corn. I was having a case having plantar lesion in sole. There was a lesion, and I diagnosed that with a plantar corn. For corn, there are several remedies: antimcrude, silicea, graphitis, ranunculus scleratus, etc. And I used to prescribe these remedies on the diagnosis of corns, painful corn in the sole. But I failed in that particular case also, and the patient went to a dermatologist, and dermatologist said, "This is not a corn. This is a plantar wart. This is a papilloma wart." And the patient returned to me and told that the dermatologist is saying that this is not a corn, this is a plantar papilloma wart, and this can be removed surgically, but it has tendency to reappear. Now, can you do anything for me? I was just astonished and changed my idea from corn to wart. And for papilloma wart, I prescribed Thuja 1 dose, and he was absolutely cured within a few days, 2 or 3 days. The wart was gone. This is the result due to failure in diagnosis of the disease. Now, another problem that may be due to failure in diagnosis of remedy. This was the failure due to diagnosis of the disease. And now another option is our failure in the diagnosis of the remedy. Some cases look alike. The remedies seem very close to each other, and it becomes very difficult to select the correct remedy. For example, sudden onset, the sudden onsetness of the disease, aconite, belladonna, coffea, ignitia, arsenic, album, borax, these all have very sudden onset of the diseases. And another rubric is acute onset of general complaints. acute, aconite, baratakar, calcarea, carcinosin, chamomilla, merxol, soranum, silicea, sulfur, and tuberculinum. Now, acute onset general complaints acute. In acute condition, there are 10 remedies in synthetic repertory. Aconite is acute, okay, but baratakar, calcarea, carcinosin, merxol, soranum, silicea, sulfur, tuberculinum. We have never studied that these remedies are having acute exacerbation also. This is sometimes the indicated remedy may be tuberculinum in acute condition. We never consider the tuberculinum, and we go to belladonna, aconite, ignitia also, etc. remedies, and we fail in treating the condition. There is a need of correct diagnosis. Without correct diagnosis, we cannot treat even a single patient. Without diagnosing the condition, we cannot ascertain what is curable in the disease. Hahnemann in his aphorism 3 has clearly wrote, if a physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, knowledge of disease indication, this is told by Hahnemann, what is curative in disease. For knowing what is curable in disease, we must have knowledge of diagnosing each and every disease. Without diagnosing the condition, we cannot ascertain correct remedy. This is Hahnemann's aphorism 3 again. If he clearly perceives what is curative in medicine, that is to say, in each individual medicine, knowledge of the medical powers, and if he knows how to adapt according to clearly defined principles, what is curative in medicines to what he had discovered to the undoubtedly morbid in the patient, so that the recovery must ensue. This is the words of these are the words of Hahnemann. I am not having my particular own language. Hahnemann's keen observations, we can see the aphorism 4. I have used only 4 or 5 aphorisms in the starting of the organon of medicine. I have not gone in the deep. In 4, he is likewise a preserver of health if he knows the things that derange health and cause disease, and how to remove them from personal health. Knowledge of disease, knowledge of practice of medicine, useful to the physician is assisting him to cure are the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of the chronic disease, to enable him to discover its fundamental cause, which is generally due to chronic miasm. We have to learn about the miasm also. In 5th aphorism, the physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual function, etc., are to be taken into consideration. In modern times, we have several tools to diagnose and analyze the condition very well, by pathology investigations, by ultrasound scannings, by radiological imagings, or biopsies. Modern laboratory investigations are infallible tools to diagnose the curability of the disease and to prescribe correct remedy with the help of repertories in books or softwares. As per instructions of Master Hahnemann, we must know what is curable in remedy, what is curative in remedies, and what is curable in the diseases. And we can diagnose the diseases with the help of modern diagnostic tools. How can we diagnose the remedy and disease very well? To avoid the failures, we must study modern terminology. What is typhoid? What is bulimia? What is anorexia? What is amenorrhea? We must know the terminology. Keeping the records of healing and cure with evidences in the form of laboratory investigation, we have to collect and arrange the laboratory investigations in precise way to learn the prognosis, progress, and extent of the disease. Prescribing in a smart way, avoiding failures. Always prescribe in a smart way. Just diagnose the disease, write down the diagnosis, write down the prognosis, write down the plan of treatment, and then prescribe the remedy, and you will never fail. Prescribing a smart way, avoiding failures, time with the evidence of cure, maintain proper records and maintain proper evidences of the cure, time to time publish your cured case histories in the various journals or seminars or social gatherings, so that homeopathy can be cherished and propagated very well with scientific evidences without any question. What are the tools to achieve the goal? Always study in a smart way. ये नहीं कि कोई भी बुक उठाकर रट्टा मरट्टा शुरू कर दिया, ऐसे नहीं होता है. स्टडी इन स्मार्ट वे, मेक प्रॉपर नोट्स and according to the need, and then study. Talk in a smart way. Ensure your presence and acceptance by scholars of universal medical fraternity among every stream of healing. ये नहीं केवल होम्योपैथी में ही हम बैठेंगे, एलोपैथी वाले भी हों, सर्जन्स भी हों, सब हों. We have to make our appearance in each and every field so that the existence of homeopathy can be appreciated and can be found each and everywhere in the medical fraternity. Study homeopathy in universally accepted modern medical terminology. Language to be accepted by all. The disease language and the remedial language must be accepted by all. If we are writing down any pain in antrum of high more, very few person will understand, and there will be very old looking diagnosis. We must clearly mention the modern technical term instead of this, and that will be appreciated by each and every medical friend. I have written a book in this way for the medical. This is the ad. I'm not going to that point. Any questions about this discussion, please? I will 1 minute. I will be discussing a case also. In Malda, there was a homeopath who was treating a case of sebaceous cyst, and sebaceous cyst was treated for 6 months, and afterward, by bad luck, the cyst was converted into carcinoma. Sebaceous cyst has very few chances, 0.045% chances to be cancerous. But in that unfortunate case, that sebaceous cyst converted into carcinoma of the skin, and the patient was suffered a lot and was treated at Tata Memorial Institute, and they guided them to treat the particular homeopath for developing such type of problems. And the case was this case was registered in the Consumer Forum of Malda, and the doctor was punished with a sum of 50,000 rupees compensation, and for the mental agony, and the complaint was worsened from benign condition to the carcinoma condition. And another instruction was given to that particular homeopath, because he was a not oncologist. The court said the homeopath is not believed to treat a cancer condition because he is not an oncologist, and the doctor was punished with that particular. In such type of cases, we must be aware that we are homeopaths. We can treat each and every condition, but that particular homeopath could not prove the efficacy of homeopathy in the court and was punished. If a homeopathy doctor is not treating sebaceous cyst, small warts or papillomas, then what will you do? The homeopaths are famous for treating such type of conditions, but very rarely these conditions can be malignant, and homeopaths are being punished by the Indian courts. This is not good. The homeopaths are responsible for that, because we have not awareness about the medico-legal issues. We must be competent with laws, and we must study the medico-legal issues also. There is a association, Indian Medico-Legal and Ethics Association, in which the allopaths, homeopaths, Ayurveda, all the system or advocates, all the streams are on the same platform, and then we can have the membership of that particular organization, so that they may help we homeopaths also. Thank you. Any question? You are welcome. Hello. Dr. Vidya, am I audible?
Yes, sir, you are audible.
Any question, please?
Sir, I have a question.
Please.
So my name is Kumar Gautam, and I am first year BHMS student at State Government Homeopathic Medical College and Hospital, Aligarh.
Okay.
So when I got to know about this seminar today, then I got to know about you that you are also an MBBS doctor along with homeopathy.
Yeah.
And sir, my question is that what made you to pursue homeopathy after being an allopathic doctor?
Yeah, this is a very good question. I completed my MBBS from Sassoon Hospital, Sassoon Medical College. This is the GMC Pune, but did not complete my internship at that time. And I left MBBS without internship and joined BHMS at Kanpur, Government Kanpur Medical College, then completed MD. And afterwards, I completed my internship in allopathy and got registered in 2000 recently with a court case. What changed my idea from being allopath to homeopath was my self sickness. I was having meningioma, which was treated badly with allopathic practice, and surgery was advised. I took gamma knife surgery also, but the condition was worsened, and I got severe headaches, visual disturbances, loss of memories, and convulsions. But with a few doses of homeopathy remedy, that was Oinanthi crocata, which was prescribed by late Dr. J.C. Nigam of Kanpur to me. I was completely cured, and there was no evidence of meningioma after 3 years of the treatment. And I just converted from I was a student of first year when I developed this condition. And
Yes,
with the final year, I was absolutely cured, and I left the MBBS without completing my internship in the and was selected in the CPMT in the BHMS Kanpur.
And sir, can I ask another question if you don't
Yes,
mind?
please. You're welcome.
Sir, I want to be a great homeopath of my time. And so, what are the invaluable insights that you can give to students like me?
Yeah. Learn, listen, study, read, and grasp that particular a huge amount you have collected. Have dare to listen. Have dare to
Yes,
read, and have dare to digest the whatever you read. And never feel shy to ask any question from your mentors, from your colleagues, or even from your juniors, which can teach you certain points at certain levels at particular times. Even juniors can teach also very, very well. And be honest. Be honest with yourself. Be honest with your homeopathy, and always use legal issues.
Thank you, sir.
Welcome.
Sir, what was the name of the remedy for that meningioma were taken?
That was Oinanthi crocata. Oinanthi crocata.
Thank you, sir.
Welcome.
And also, wanted to know how do you differentiate between acute remedies and sudden remedies, the rubric?
Yeah. Let me come to that particular slide.
Thank you so much, sir, for such an enlightening session. It was wonderful.
Thank you. Let me explain the acuteness and suddenness of the.
Sure.
Let me come to that part. This is sudden onset, that is seen in aconite, belladonna, coffea, ignitia, arsenic, borax, etc. This is sudden onset of the disease. The condition may be acute or chronic, whatever it may be, but the onset is very sudden. You were not expecting the onset of the particular ailment. But in acute conditions, the aconite, acute means the condition is very severe and very difficult to manage, and patient is fighting between life and disease. And aconite, barattacarb, calcarea, carcinosin, chamomilla, merksol, soranum, silicea, sulfur, tioral. These remedies have such a diseases which are very severe in nature, which are life-threatening complaints. In such type of life-threatening complaint, we use the term the acuteness of the disease. These are the remedies for this.
Thank you, sir.
We have one more question, sir. Is there any protocol for treating hypertension?
No, there is no protocol. The legal protocol is not there for treating hypertension. Each and every homeopath can treat hypertension, but we have to diagnose the cause of hypertension, because it may be essential hypertension, it may be right port hypertension, it may be due to capillary or blood vessels vascular hypertension. It may be renal hypertension, it may be electrolyte imbalance hypertension. There are several type of hypertension. Some of hypertension may be acute, some type of hypertension may be chronic, but we often face the homeopaths are facing the cases with chronic hypertension, because in acute hypertensive states the patient want to get treated with cardiologist or allopathic doctors, because they have sudden onset of hypertension and they are very frightened of the prognosis, and they seek the allopaths for that. But in chronic cases, we have to diagnose why the hypertension started in that particular case. Maybe organic cause, maybe psychogenic cause, maybe essential cause, or maybe some malignant cause.
Thank you so much, sir, for this session. And now I would like to invite our patron, Dr. Yudhvir Singh, sir, for his comments. डॉक्टर वीपी सिंह सर, आप सुन पा रहे हैं मुझे? I think there is some network issues on its side. And sir, we would like to honor you with the appreciation certificate for such an enlightening and wonderful session. Kindly accept it from DHMA team. Congratulations, sir.
Thank you very much. Thank you.
Now, in this line, we have a quiz for the participants, and I would like to invite Dr. Deepti Adhikari for conducting that one for all of you. Dr. Deepti.
Okay. Thank you, sir, for such an informative session. So let's start with the quiz competition. So before we proceed, I would like to tell a few things that whoever wants to give answer, please do not speak. Just write down your answer in the chat box. And whoever gives the correct answer first will be the winner. And executives are not allowed to participate. Dr. Usama, please pay attention who gives the correct answer first. And please note down their email IDs so that we can send them certificates later. So let's get started. So the first question is, craving for potato is of which symptom? Psoric, psychotic, syphilitic, or tubercular? I think Dr. Priyanka has given the answer, right answer first. Dr. Priyanka, please write down your email ID also. Psoric is the correct answer. Okay, so next question. Always feels better by walking slowly about, although weakness obliges the patient to lie down, is a symptom of which medicine, which remedy? ferrum, which ferrum? Ferrum med, ferrum phos. Dr. Jyoti has written ferrum, only ferrum. Ferromet, ferromet, yes. Rinku Malhotra, Dr. Rinku Malhotra has given the right answer. Ferromet. Please, Rinku Malhotra, please share your email ID. Next question. Vomiting in any position except lying on right side, followed by drowsiness and prostration, is a symptom of, yes, Dr. Priyanka, anyone? Okay, Dr. Priyanka has given the answer, but you have already given the answer earlier also. So I will ask next question. Okay, those who have given correct answers earlier also, please don't give answers if you are damn sure about the answer. So I'll proceed to the next question. Okay, amelioration by natural discharge is a which symptom? Soric, psychotic, syphilitic, or tubercular? No. Soric, yes. Dr. Neeta. Dr. Neeta, please share your ID. Soric is the right answer. Next question. Dyspnea or asthma when the patient can only breathe by standing up? Anyone? No. No. No, not the correct answer. Anyone else who want to answer? No, not Briny also. No, no. No, not Bell also. I repeat the question. Dyspnea or asthma when the patient can only breathe by standing up? No, not lobelia also. Specific medicine? No. Yes, cannabis sativa is the right answer. Dr. RPS Homeo, please share your email ID. Next question. Heart goiter in light-haired person. Bromium, yes. Dr. Deepika Mehra. Please share your email ID. Next question. Jaundice with heart disease. Yes, digitalis. Dr. Jyoti. Dr. Jyoti, yes. Please share your email ID, Dr. Jyoti. So this was all about the quiz competition. Now over to you, Dr. Shweta ma'am.
Thank you, Dr. Deepti. And it's great to see the enthusiasm of all the participants. Congratulations for the winners. And we are having with us Dr. VP Singh, sir, Pattern of the Association. And I would like to invite him for his comments. Dr. VP Singh, sir. So sorry, I think he's having some network issues again. So let's end the session with a happy note, with a great learning from Dr. Rajneesh sir. And I would like to thank him for this wonderful session. It was wonderful, sir. Thank you so much. And I would like to thank my executive team for their continuous support and selfless service with which we are able to continue these services towards homeopathic world and these webinars, CMEs for the keen learners of homeopathy. I would like to thank all the viewers and followers who joined us today. I hope the sessions are up to their expectations, and we have many such wonderful sessions lined up in future. So kindly join us for the future sessions. If you miss this session or any part of this session, you can subscribe our YouTube channel. The recording will be uploaded to there. So shall we end?
Dr. Shweta, can I make a request? And Dr.
Yes.
Deepika at the time.
Yes, ma'am.
Actually, I like very much the way Sir talked about all his failures. So can we have a forum or can we have a monthly meet where anybody can come forward with their failure cases and let us come out with a, with the right remedy so we can help the patients.
For your information, ma'am, if you're not associated with the DHMA yet, we have our WhatsApp group where we can discuss such cases, and we have Dr. Rajneesh and all others esteemed physicians there, so we can have that discussion there also.
Can I get the link of the WhatsApp group?
Yeah, sure. We will share it with you, and you can note our contact details. Can you please share, Dr. Deepti, or anyone of the executive, please share the details, contact details of DHMA in the chat box. Yeah.
Okay. Let me.
Or you can email us at dhmadelhi@gmail.com. We can provide you with all the necessary details.
Yes, sure.
Yeah.
You can write down the contact details. You can get in touch with us at 9711 423 617. I'm repeating the email ID dhmadelhi@gmail.com. So thank you all of you for joining us today. Have a nice day. Thank you so much. Goodbye.
Sir,
Shall we end?